Hello everyone, I'm Krystal from the Communications Committee. We're here today on the second day of the ISPRM 2026 Vancouver Congress, and I am delighted to have here today Professor Abderrazak Hajjioui from Morocco. Thank you for joining us today, Abderrazak.
Thank you.
You did an excellent keynote lecture on strengthening rehabilitation and workforce development in low-resource countries. Can you tell us a bit about the talk for our listeners who couldn't join us today?
First, I can say that when we talk about rehabilitation, people think that we talk about technology, about infrastructure, but the fundamental element is people with trained workforce, with skilled workforce. We can build a health system and rehabilitation.
What are some of the barriers to building a sustainable workforce in low-resource settings?
The main barrier is that we use the workforce models imported from high-income countries without adaptation to the national context. So we need to build a workforce model adapted to the environmental factors and barriers in low-resource settings and train adapted to this model. Imported workforce models show that it can work in everywhere.
Yeah, and that's highly critical and highly considered points that we need. What are some of the key tools or effective strategies that you recommend for globally?
Yeah, we need to invest in education and leadership, because if we have leaders in rehabilitation workforce, we can change the health system. We need to invest also in research and training with quality of education and training. We need to connect between the different regions and also different stakeholders and to work together, because together we are strong and alone we are weak. We need also to develop our advocacy skills, because in low resource settings, a workforce should work as clinician, but also as advocates, as educator, as build the health system. So we need to develop the model of education, not only for clinicians or technical aspects, but global aspects of the workforce.
Fantastic. Couldn't have said it much better. Thank you for your time today, Abderrazak.
Thank you.